The energy crisis has hit hard at healthcare delivery in the country. In the Western Region, authorities at the Takoradi Hospital must raise 16,000 Ghana cedis every month just to buy fuel to power their generators. Here's a report by William Benjamin Peters.
The din caused by the generator is a welcome for any visitor to the Takoradi Hospital. It was evident that the facility was without electricity. About 6 empty yellow gallons, popularly known as Kufuor gallons, were lined up near the generator, sited close to the hospital morgue. The hospital spends 8,000 cedis every 2 weeks and 6,000 cedis per month on fuel for the generator. Administrator Frank Ousu Asari says the hospital is operating at a loss due to this expenditure. They are indebted to suppliers, some of whom have threatened to cut off their services if the hospital does not pay up. He, however, assured that the facility has no intention of sending away any patient or charging extra due to the situation. Frank Ousu Asari, however, reiterated the need for health facilities to be hooked onto solar energy, which includes newly constructed facilities in the country.
It actually poses a very big challenge to health managers, how you'll be able to survive, and perhaps even in the future, how even we have to run health institutions. I think now the best way to go is that we have to look at solar, because there is no need providing very beautiful edifices where women's service cannot be provided because of electricity.
Unfortunately, irregular reimbursement of health insurance money is also another challenge confronting the facility, with the hospital being owed 619,697.17 cedis by the National Health Insurance Authority.
Authorities of Jabeng Government Hospital in the Ashanti region rely on funds from hospital's mortuary to buy fuel to power a standby generator to keep the facility running. The hospital spends 10,000 Ghana cedis every month on fuel in the face of the worsening power crisis and delayed payment of health insurance claims.
Over 130 outpatients receive healthcare services daily here at the Jabeng Government Hospital. Giving quality care to these patients is, however, now a luxury. With a monthly 10,000 Ghana cedis fuel bill to power the generator, operational costs have shot through the roof and the hospital can barely afford anything else. The situation has been compounded by low voltage from the national grid. Thus, when there is supply, it is inadequate to power hospital equipment and standby generator must be turned on.
You can't power some of the machines. You need to put it off and put on the generator because the current is so low. Even common TV, it cannot power the TVs. I told you also that we need power to pump our water to work with. We are using borehole to pump water to run the services. And because of the current nature of the current, as we sit here, we are having electricity, but the water is not pumping because the current is not strong enough to pump the water.
As part of control measures, the generator is turned off at 11 p.m. Health workers and patients have to resort to torchlights, lanterns, and mobile phones to see their way through till daybreak.
If we are able to work on the station and there's no need for the light to continue going on, we put the generator off and put it on the next day to work.
Authorities buy fuel on credit from local dealers who are reluctant to continue to supply due to mounting debts, especially with NHIS claims payments in arrears. To pacify creditors, officials have had to rely on the hospital mortuary proceeds to offset the debts and avoid total closure. Officials will not say what percentage of revenue from the mortuary they are using to buy fuel, except to say it is currently their lifeline. Bawa Osman is administrator at the hospital.
On average, you spend about 10,000 Ghana a month on fuel alone because every other 2 days you need to buy 1 drum of diesel to power the generator.
It is 6:20 p.m. here at Ifijiase in the Setre East District. The entire town is in darkness. Checks reveal, as usual, they are off the national grid tonight. But with the help of the generator, the situation at the Ifijiase Government Hospital is lit. Authorities have to buy fuel which averagely cost the hospital 9,000 Ghana cedis a month. Here is a patient, Mamisewa.
Authorities attend to us with the aid of torchlight.
Torch no dia use amount. No, they are sure.
Even though hospital authorities will not speak on camera, they lament over the situation. The generator here also goes off at 11 p.m. However, there's a small generator that powers the maternity ward.